As a record number of children across the country are being hospitalized with common respiratory viruses, we talked to experts from a number of universities about why this is happening.
The million-dollar question is, are we really seeing more severe cases?
For months now, pediatric hospitals have been overflowing with young kids becoming critically ill with common viruses like RSV and flu. All four experts we spoke to believe an immunity gap is playing a major role in the sheer number of children being hospitalized.
For the last couple of years, kids and everybody have been social distanced, wearing masks, etc. And so therefore have not been exposed to many viruses. We're just seeing a surge. It came earlier and with greater numbers. And in those greater numbers, you're going to have a subset of kids who get very sick. And what is a little bit different is that we were not as not familiar, but it wasn't as commonplace that the older infants and young toddlers were getting so sick.
Other challenges are also at play, according to Dawn Bowdish, the Canadian Research Chair for Aging and Immunity.
All these seasons are overlapping. Generally, RSV comes a bit later, March, and influenza a bit later. But with everything happening at the same time, children are more likely to get co-infections, so having two things at the same time. Those have always been a lot more challenging to treat.
Another theory being explored is the impact COVID-19 infections could be having on children's immune systems, possibly causing harm and making them more susceptible to other viruses. Samira Jamie specializes in immunology at Western University.
And there's actually a growing body of evidence in adults related to secondary immune deficiencies related to COVID infection. So that's one hypothesis.
But data is scarce when it comes to kids, with most of the COVID-19 research focusing on adults. Matthew Miller, a pediatric infectious diseases specialist at McMaster University, tells me what's happening now warrants much deeper investigation.
That's the key question that we really need to know in exquisite detail, is differentiating between a higher number of cases, which we would reasonably expect as a result of those viruses basically disappearing during the first couple of years of the pandemic due to public health measures, or whether or not those cases are actually more severe than we would normally expect, which would suggest that something altogether different is going on.
And Jamie says not enough is known to believe nothing more is at play here, and next year, cold and flu season will be back to normal.
I don't think it's rational, really, to hang our hat on a theory. I would like to be wrong on this, but what if it's not over? I do think the probable answer is going to be that it's multifactorial.
Shauna Hunt, City News.